I was talking with a woman last week and she said something that really stuck out with me. She said, Alissa, I'm learning a lot about my pain lately and it's been really good for me, but I'm at a point where I just want to know what to do. Like there's so much information out there and no one ever tells you what to do. It's like I'm on information overload and don't get me wrong, it's been helpful, but I'm at a point where I just want to know what to do. Like what are the practical steps? And I totally get it. Like I really do. When you've been in pain for months or years, you don't want more information necessarily. You want to know what can be done. You want someone to lay out exactly what steps to take to actually make an impact. Plus, sometimes all the information can be a little bit overwhelming without having any clear direction. You probably already spent countless hours researching, trying to piece together your own solution from little bits and pieces from that you found online or in books or from different providers. And that's exhausting. Sometimes you just need the exact steps, like to be told, like, here are the steps, and this is what to do. And so that's why today I wanted to talk about how to reduce your pain, like the practical steps, by repairing those overactive pain pathways. So I'm going to walk you through the 5-phase process that I use with my clients that has helped hundreds of women with all sorts of pain, different diagnoses, some with structural issues like degenerative changes or neuropathy or nerve damage, and some whose scans and tests all came back normal or within normal limits. Women who'd thought that they'd tried everything, who were tired of fighting, who have now, after following these steps, found relief in ways that they didn't think was possible. And this isn't just some random advice that I've come up with. Like these steps, okay, this system has taken me years to develop and to refine. I mean, I've spent over a decade poring over different medical journals and textbooks on chronic pain in my spare time because I knew that what I was doing, right, the physical therapy stretches and exercises and the manual therapies and modalities, it wasn't enough. Or I should say, it wasn't effective for all types of pain, right? That was the problem. We were treating, and the medical system is still treating all pain the same, and it isn't. And so I learned a ton. Ladies, the research is out there. It is there, but no one, it seems, is putting it into practice. No one showed me how to do this. There was no model to go off of. So I had to sort of like step out of my own comfort zone and try things that I'd only read about in research studies. So what I've done over the years is I have pulled together the science from many different studies and integrated different strategies from different approaches and different theories. And over the years, after working side by side with my clients and my patients, I've learned the best way to layer all those pieces together, right? Like the sequencing and the strategy, all in a way that it can actually be used in real life, because this isn't a research study, so that you can get the best results. And I can tell you, there were plenty of sleepless nights and moments where I felt like I just like wanted to give up because sometimes I feel like there's this culture of instant gratification where we expect immediate solutions packaged in 15-second videos or in one-page PDFs, as if that could solve years, sometimes even decades of pain. And yet that's what you see everywhere. That's what we've come to expect. I mean, I've spent my entire career striving to understand persistent pain, researching it, refining the methods. I've invested a ton in advanced specialty training, and yet you've had no choice but to rely on these cheap gadgets and injections that are not helping long term and care from providers that is not evidence-based, that does not support your recovery. The wellness industry thrives on selling these quick fixes, the red light laser mats and the miracle supplements, the one exercise that supposedly fixes everything. So no wonder you're skeptical because you're starting to see through those false promises. And if there's one thing that I've learned after years of being in this field, after launching several different pain programs across the US, it's that while quick fixes might offer some temporary relief, they don't address the underlying issues. So they're always going to leave you feeling more disappointed and more defeated every time. And so that's why today I want to share something different with you, a more comprehensive approach, a systematic approach, rather than just another random tip or, a bunch of random strategies or techniques where it's like, try this and figure out what works for you. That's not a strategy. Complex Persistent pain isn't something that can be solved with these isolated strategies that mask individual symptoms. There isn't one single solution or strategy that on its own fixes everything, right? It's not just about finding the right stretch or the perfect exercise, the ideal medication, or even the most cutting edge procedure, right? Pain itself is multifaceted, so it requires a multifaceted approach. And I have to say all that up front because I want to set proper expectations because this approach, I'll be honest, it isn't for everyone. What I'm about to share isn't a miracle cure or a quick fix. But if you are looking for a more comprehensive system, one that is evidence-based, one that gets to the deeper cause of persistent pain, then this is for you. Yes, it does require consistency and commitment, but it actually works. So that being said, let's get into it. Let's talk about what actually does work. Okay, so these are the 5 phases that I work through and customize with all my clients to help them to reduce their pain and rebuild their life, their quality of life. And it's a layered system, meaning each phase builds on the ones before it. So number 1, phase 1, the first step is to discover what's influencing your pain. What's really influencing your pain? Think about it like this. If the check engine light comes on in your car, you have to take it to the dealership or to the mechanic so that they can run their little diagnostic tests to figure out why the check engine light came on in the first place. If you don't run that diagnostic and you just start trying to fix things randomly, it's like throwing spaghetti at the wall, right? You may not be treating the right problem or all of the problems or issues. Maybe there's more than one issue. What a lot of people don't know is that chronic pain often involves having overactive pain pathways. This is an often overlooked issue that contributes to symptoms of ongoing pain. So it's really important to understand how your pain system could be contributing to your symptoms. Now, I know that a lot of you listening have already done your research. You know your pain, your condition, probably better than most of your doctors. And so this step, understanding what's influencing your pain, means to really dig in deeper into the more hidden issues, some of the things that don't show up on our MRIs or nerve tests. Things like, how do your nerves become sensitive? Like the physiology of what's going on in your nerves, or the programmed pain responses and the sensory processing adaptations, and why pain feels so unpredictable or inconsistent. It means finally making sense of what's happening in your body, like your hormones, the internal and external factors that cause your symptoms to spike. And honestly, genuinely, this phase for so many people is so freeing. It's so restorative. It restores hope. Because when you've heard so many conflicting explanations or vague explanations from providers who've told you over and over, your pain is a mystery, it feels chaotic. It feels confusing because maybe the scans don't really explain what you're experiencing, or providers have made you feel like it's all in your head. I've spoken to hundreds of women who were so desperate for someone to tell them why they hurt, for someone to explain what they were going through without saying it's all in your head. Having the science, the biology of what your pain system is doing, it's like clearing that chaos and that confusion away. And when you have this kind of clarity about what's influencing your pain, you can finally start understanding your pain patterns, even if it feels like your pain is totally random. And guess what? You can then respond more appropriately to your pain and your symptoms instead of feeling blindsided by them and then feeling like you're throwing spaghetti at the wall because you're just guessing. And yes, even if you have structural issues, this still matters because your MRI doesn't tell the whole story. Your physical diagnosis doesn't explain the whole story. So this phase helps you see the bigger picture. It's the first phase in the recovery process into rebuilding your confidence in your body. So that is the first step, is to get clarity on what's influencing your pain, because you have to know the nature of the problem you're dealing with before you can heal so that you can take more appropriate action, right? The next step, or phase 2, is to create the ideal state for healing to happen. And I'll tell you what, no one really wants to do this step. Everyone wants to just get into the strategies, tell me what I can do so that I can start fixing this as soon as possible. And I get that. And yes, the strategies do help, but there are some things that you can do to optimize the strategies to become more effective. And sometimes if you don't, it's like your body is fighting against you because it's not in a healing state. You can almost think of it like applying primer before painting a wall. I just had to do this when I was repainting my back door. Before you can paint, if you sand it down and you apply the primer first, it's going to ensure that the paint adheres well, that the paint color looks good, and that it lasts so much longer, right? So, in the same way, there are some initial steps that we can take to create the ideal conditions for your recovery to happen. So, for example, we need to work on sleep, okay, or to optimize your sleep, because if we're trying to repair these neurologic pathways, well, your body, our little microglial cells, they go in and they clean up and prune your synapses while you sleep. So those other strategies, how well are they going to work if you're not getting good sleep, right? So we want to optimize your sleep so that those strategies can actually be effective. Then another thing we can do is to use some breathing techniques to improve your ability to heal. Now, the breathing here isn't the treatment itself, okay? I know that for some people that breathing drills can be very powerful for reducing pain, but in this case, we're using it as a tool to enhance the other strategies that come later on. Make sense? So sleep and breathing drills, a couple of the basics, and then also something that's really important in this phase to allow healing to happen is to not just manage pain when it gets bad, but to prevent it from getting so bad in the first place. Right? If you've been living from one pain flare to the next, or you get seemingly random spikes in pain, or your approach has been to just do as much as you can on your good days, and then you end up paying for it later, recovering for days or weeks, it's reinforcing those pain pathways. So we need to get out of that pattern with a pain prevention plan, a way to be able to predict and prevent both those big pain flares and those smaller day-to-day spikes in pain. And also have a plan for how to manage them, right? How to get out of them when the pain does spike as soon as it starts, because you won't be able to prevent every single flare. And that's the reality. But having a plan, knowing exactly what to do the moment that one starts, you can get out of it much faster. Many of my clients would have these like week-long flares that they're then able to reduce down to, say, 24 hours. So just shortening the length of time where the pain is really bad. So hopefully you can see how important this step is to create these ideal conditions for recovery. And I get it. Nobody wants to work on their sleep. Doing breathing drills isn't sexy or exciting. And lots of folks have done these things before without seeing any results. Well, what you need to understand is that these steps are not the treatments themselves, but they are like the pre-treatment steps, right? This isn't the paint. This is the primer. So that is phase 2, where we set you up for success and build the foundation. Then phase 3 is where you build your tolerance for activity. Okay, most of the women I work with find themselves in this like push and crash cycle. They grin and bear it, they push through, they overdo it because it feels like it's the only way to get anything done. And then they end up paying for it later. And then many will end up eventually feeling really afraid of certain activities or movements that they become overly cautious because they aren't sure of their limits and they don't want to spike their pain again and suffer the consequences, right? This pattern is strengthening those pain pathways and making the pain system more overactive and sensitive. So in this phase is where we start to break down those patterns and pathways and create new ones by what I call pacing, or pushing to it, not through it. Okay, this is where it starts to get really exciting because this is when you start doing more without paying for it later in pain. Okay, not by following some generic return to exercise program or no pain, no gaining your way through this. It's pushing to it and not through it. Now, I know that that sounds really great at first in theory, but what if your pain is constant? Or what if your tolerance level is already really low? Or what if your pain feels totally random? Or what if your pain is delayed? Like it doesn't always come on during the activity, but it gets worse hours later. We take all of those things into consideration. We have to factor those things in as well. So if your pain is constant, random, delayed, or if your tolerance level is very low and everything you do hurts, you can still be extremely successful with this approach. This isn't some cookie cutter, black or white, all or nothing approach, right? So rather than giving you some generic cookie cutter protocol to follow, this gives you the knowledge and a simple strategy to follow so that you can progress on your own based on your tolerance level, based on your symptoms and how your body responds, right? So that's step three, to push to it and not through it so that you can build your tolerance for activity. And then we're going to continue to apply that push to it, not through it strategy when we do the strategies in step four. So step four is where you resensitize your pain pathways. There are some specific strategies that reduce nerve sensitivity. Okay, those are some specific movements. In fact, those are the only movement-based strategies in this entire process. And then we layer those together with a series of strategies that help to improve sensory and tactile processing and help to break down those pain patterns. And so those strategies, like I said, they're helping to reverse these sensory processing adaptations that occur in the brain. And we do that by layering together a certain set of strategies. Okay, these are simple things that you can do each day. They don't take a whole lot of time. And each strategy must be fully adapted to each person, which is why I can't give specific examples here, because what might work really well for one person could actually be really harmful to another person. And if these strategies are not done correctly or adapted to where you have pain or your sensitivity level, it could have the opposite effect that we're going for and cause more sensitivity. The goal is to not make things worse. This is not this thing where it has to get worse before it gets better. So I actually teach my clients how to not flare themselves up when they do these strategies. I teach my clients how to customize the strategies for their unique situation so that they can progress them themselves. And honestly, I know sometimes it's much easier just to be told what to do, but it's much more valuable to be taught the strategy so that you can then build and adapt your own plan and progress it yourself so that you're not relying on someone else to tell you what to do. You know what to do intuitively, right? So the strategies in this phase four, will help you to lower the reactivity of your entire system, to reduce the sensitivity of the system, lower the baseline sensitivity level overall, and to retrain your body's responses to different sensory inputs like stretch and pressure or temperature, movement, even changes in blood supply and stress, or changes in inflammation or these immune system responses. It's kind of like we're recalibrating the fire alarm that had these sensors that had become overly sensitive to where it started going off when you just like blew out a birthday candle or took a hot steamy shower. We're teaching that fire alarm to not be so sensitive. Okay, this isn't about teaching your brain to ignore pain or convincing your brain that you're safe or that you're not injured, because you do need to know when you're injured. Pain is, after all, a protective response. So this isn't about training your brain to never have pain, but rather it's about training your brain to correctly interpret when there is an injury so that your system isn't just responding to every single thing or every little input. And again, these strategies are not about meditation or the vagus nerve or somatic tracking or even desensitization. Not that those things don't help some people, but the strategies in this phase are different because they directly target nerve sensitivity and overactive pain pathways. And this step, along with everything that precedes it, is very important because once we get that sensitivity level down, we lower that baseline, then we can start rebuilding the strength, the flexibility, the endurance again, because you're going to be able to tolerate more exercises. And that is what phase five, the last phase, is all about. So phase five is where you regain the physical resilience. Phase five is where you bring back the movement type things like stretching and strengthening and exercising, because those things are important too. Most of the people I work with have, to a certain degree, physical issues, muscle imbalances, stiff joints, weak muscles, compensatory movement patterns. All of that is important. And they benefit from doing the physical therapy type exercises, but they struggle to stay consistent with them because the exercises are too painful, or they do them, but it takes them days to recover after. And so they can't be consistent enough to really make significant gains. Most of the time, we're taught to start with this phase. When we have pain, we start by doing the physical exercises and stretches first. But you can see here in this system that that is the last phase, because with this type of pain, we need to do things a little bit differently, because we need to lower that sensitivity level first so that you can then tolerate the exercises and actually benefit from them. Oftentimes, I see people working so hard to stretch, to relieve some tension, or they're strengthening to no avail, and they feel like they're not actually getting anywhere. Oftentimes, that's because the pain system is so overactive that it's actually causing those muscle imbalances. It's telling certain muscle groups to stay active and so tense, to tense up and tighten up as part of your body's protective response. It's protecting you, it's guarding those areas. And your pain system, also as part of that protective response, shuts off the smaller little stabilizer muscles. So you might be working really hard with your physical therapist to strengthen those muscles and to activate those muscles, but they just won't kick on. And instead, different muscle groups are kicking on. And this is all happening outside of your conscious control. And so instead of actually helping and strengthening the right muscles that you're trying to strengthen, it's actually doing the exact opposite. It's activating the wrong muscle groups and making the problem worse. So instead, we're going to work on lowering that sensitivity of the pain system first, and then bring back the strengthening and stretching components so that you can build your physical resilience without so many setbacks, without feeling like you're taking one step forward and three steps back. So this step, it's not about reinventing the wheel in terms of giving you new or different exercises to focus on. In fact, most of my clients, if not all of my clients, have been through so much physical therapy, they could write the handbook themselves. You may already know which exercises to do that you would benefit from, but you need a way to do them that's not going to activate those pain pathways again and again or put you at risk for re-injury, right? Because if you're just ignoring pain and pushing through it, then how will you actually know if you're injured? So this isn't a boot camp. This isn't about generic exercise routines. This is about teaching you how to build your own routine to regain your strength and your flexibility and your physical resilience that in a way that fits you so that you can start moving more with more ease and less tension and less discomfort. So those are the 5 phases, right? Again, first, discover what's influencing your pain and then create the ideal state for healing to happen. Then boost your tolerance for activity. Then resensitize your overactive pain pathways. And then lastly, rebuild physical resilience. Each of those phases builds on the ones before it. So you layer each of the strategies from each step together. So you go through this process and then you just start integrating everything together consistently, right? You progress and you adapt as your pain levels decline and your activity tolerance level increases. It's not an overnight fix, which again, this is why I say that this isn't for everyone. But if you can commit to this process, it is worth the time that it takes. And I can tell you from experience, these steps work best when they're done together. Could you skip steps? Sure, you absolutely could. But when we cherry pick strategies, you won't see as much progress because you can't fix a complex problem with a singular strategy or one exercise, right? It just doesn't work that way. Each step solves a specific problem that's been holding you back. And these steps, they're not hard. They're not hard things to do. I'll tell you that probably the hardest part is not having the structure, not having the plan or the knowledge or, right, like knowing what to do and not having the support to guide you through it. The support is a really important piece. We all like to do the self-help thing. We'd all like to DIY the process. But one of the biggest reasons people struggle to implement effective pain care strategies over a long period of time is the lack of support. Because when you're doing it alone, eventually you get confused, you have setbacks, you have questions, right? Everyone has unique challenges. And without support, it's very easy to give up and walk away and just move on to the next thing, right? Trying to figure this all out on your own can be really difficult. And so now you know the plan. You know what the steps are. You know there is a structure. You know there are strategies and a process to go through to be successful. But most of my clients end up working with me because they want that support, because they don't want to waste more of their time with the guessing. They don't want to go through the trial and error thing because it's also overwhelming. For them, it was that they wanted to make sure that they were doing things correctly and not making things worse and having someone to turn to when they hit obstacles or when their pain would spike and flare up. And having accountability to stay consistent with practices that don't necessarily provide immediate gratification, but lead to long-term relief. So if you're listening to this and you're thinking, yes, I need this. I know that I'd benefit from these steps. I've never had a plan like this. This is exactly what I've been missing. Then let's have a conversation, just you and me. This is the exact system that I walk my clients through inside my program, the Chronic Pain Breakup Method. And I would love to help you figure out what this would look like for you. So if you want to explore what working together could look like, just go ahead and set up a free pain care call with me. I'm here. This is what I do. And if you're ready, I'd be honored to help you. Thank you for listening today. I truly do hope that this information has been helpful. Until next time.